Health officials continue to stress the importance of vaccinating more young people, children in particular. But what happens if parents and children disagree? 13 on your side's Angela Cunningham spoke with experts about what rights kids have on the topic.
Yes, the ability to be vaccinated without parental approval largely depends on what state you live in. Here in Michigan, for the most part, minors must do whatever their parents say. It's an issue that's been popping up across the country ever since teens 16 through 18, followed by those 12 to 15, have been able to receive the COVID-19 vaccine. Now, there are a handful of states where minors as young as 14 or 15 do not need parental approval. The age varies state to state, and that is because lawmakers in those states created statutes allowing that. I spoke with the regional director with the Network for Public Health Law. She tells me Michigan does not have any laws that would allow a minor to obtain a vaccine without parental permission unless they are emancipated. So here, this issue would have to be taken up in the courts. However, she says based on the current climate, she could see that changing soon.
Absolutely. And when we're talking about participation in sports and all of the other potential exposures and minors who want to be vaccinated, very much so. And it could be a matter that would receive legislative attention.
Now, in Michigan, there are certain exceptions where a doctor can treat a minor without parental consent, but that is typically in cases where life-saving measures or certain sensitive services are needed. Again, that could require the courts to get involved.
Now, if we had a teenager who we thought was at very high risk of COVID-19, getting the virus or suffering very severe disease from it, then we certainly would want to be more persuasive in our discussions with the family. But there are other things that we can do to prevent COVID-19 than only the vaccine.
Now, that was Dr. Rosemary Olivero here at Helen DeVos Children's Hospital. She says in most cases, she believes medical providers can help parents and minors resolve these issues by simply listening to them and educating them. Back to you.